in simple terms to mean she will have to live on a medication for the rest of her life?
Not really medication, but managing her lifestyle.
Okay.
Yeah.
How?
Okay, you know the main work of the kidney is to clean blood.
Yeah.
See, so she needs.
Wow, ladies and gentlemen, karibuni sana. Of course, this is Pastor Show, the leading channel in East and Central Africa. Tuko hapa hivi, mambo ni mengi, muda ni mchache. Definitely bado pilika za hapa kule. Sad news, Grace is still in ICU, and we are hoping for the best. We are praying so hard atoka ICU anytime soon. Na sahi it's like hata tumefungwa. We cannot do much kwa sababu mnajua I'm restricted. Kwanza lazima hii hospitali at any given time kuwe na mtu, even though hatuingia ICU, lakini kuwe na mtu. Si ni kweli? Na mnajua tulishajitwika jukumu kwamba we are the people responsible for this. So sometimes maybe you might feel some delays labda in terms of consistency ya kupost, lakini najua mnaelewa the reason as to why. Last time tuliongea na daktari, although he was in a kind of a meeting, lakini leo tumepata nafasi kwanza tuje tuzungumze na yeye na pia tuelewe the condition yenye Grace ako up to now. Alright, so I want to welcome you all to this episode. This is Pastor Show. I'm your host. Of course, you're watching the best show in the world, and I'm hoping you have subscribed, taken your time to subscribe to this episode, to this show, and of course we grow together. Alright, maswali ni mingi, muda ni mchache. Daktari,
yes,
salimia kwanza watu sana. I'm okay myself.
Hi.
Yeah.
Vipi?
Tuko salama.
Pole. Last time nilipigia simu, mimi sikuwa ofisini. Unajua meetings za hapa nje hapa na pale, lazima pia tuna coordinate na hospitali zingine juu ya kazi. Hii kazi yetu na coordinate. Karibu tena.
Poa sana. Before hata tuendelee sana, nataka kwanza turudi nyuma kidogo kuhusu Brayo. Brayo, the first clinic alikuja, ilikuwa lini? Tulikuja lini? Amekuja the last clinic. Ulimuassess ukamwona aje?
Brayo is responding very well, actually. Sahi compared to the last time, the previous visitations yenye amemake kuja hapa, Brayo is good. Hiyo naweza kuambia, it's something I can attest to you that Brian is very well right now.
Mbona ulimpe 6 months ya kukuja clinics?
Okay, nilimpea 6 months ndio tuweze kumonitor the body change and behaviors, tuone kama ana respond to the medications kwa tunampea.
But so far he is okay.
So far he's okay. He's okay.
So I'm also very happy, by the way. Actually, the thing that will always make me choose this hospital is because of how you handled kesi yake Brayo.
Thank you.
It was handled in a very nice way.
Thank you.
I was impressed, and that's why even right now we are here, and I know mpaka hii najua go through.
Thank you.
Sure. I was talking to a psychologist the other day, and he was telling me the essence of psychology kwa watu kama Brayo, mamake, watu wenye wamehusika. Do you recommend it?
You remember Mama Brayo actually alikuwa ameka hapa hiyo siku, nilimwambia she needs a lot of counseling, psychological counseling, because watu wawili wamepitia psychological torture. So it needs a lot of psychological counseling from a specialist who knows how to do counseling very well and imsaidie juu ya mawazo.
Let's jump back to Grace story. How is she? Because of course najua mimi najua condition yako, lakini you are the person authorized to say vile yako.
Sure. So Grace 24 years. So Grace was brought here. I'm very sorry under my tight schedule, but niliweza shughulikia. That is when she was brought, I got a call that we had a patient mwenye alikuwa in a critical condition. I came here, we managed to stabilize her, but she had to be kept in the ICU because she was very unconscious. Akwana, she could not breathe by herself, unaona. So many things in the body, like the body organs couldn't like do things in their own, so we had to put her in the ICU for supports by the machines. So when Grace was brought here, I believe najua kidney moja ilikuwa
hapo ukiongea kidogo I assessed her kidogo tu ile, just like a normal person anaweza fanya, a layman. I'm not a professional doctor at all. Na kwa mikono alikuwa mbaridi, kwa miguu alikuwa mbaridi, alikuwa na kajoto hapa hivi, and at least unge feel some pulse za roho. Kwa nini alikuwa mbaridi mikono na miguu?
Okay, the when she was removed the kidney, there was damage to the surrounding organs in the body. So because the people who removed the kidney did not remove it in a professional way, unajua kuna ile, you come to the hospital, there is a surgery done, and it's a surgery done by professions to remove the kidney, but to her way, the way the guys did it, they never did it in a professional way. So obviously it could bring effects to the body. The heart could be beating, but because of the excessive hemorrhage due to uncontrolled bleeding, it was certain that she could be that way.
Another question that I was having, can we say she was half dead? Will be correct to say so?
Okay, we can say so because of the anesthetic drugs they used, because they couldn't just rupture her stomach to remove the kidney. They had to use some anesthetic, which anesthetic definitely keeps your body half dead. So I believe it's a usage of excess anesthetic on her body.
Watu wengi wanasemanga kama saa hii mtu akwe diagnosed with cancer stage 4, chances za kupona zinakuanga kidogo sana. Na majority wanasemanga it's very expensive to treat, and definitely the patient will die. Are we using so much and Grace is not going to survive?
Not really. Okay, as doctors, our work is to give her medication, but we believe God will enable her heal. You see, it's a combination of us giving our expertise on what we know to control the wound, like to treat her, but God will definitely heal her. So as to me, I'm very positive about Grace getting better. I'm very positive.
I'm asking these questions because I definitely know there are so many people who are saying there is a very high chance that she will not survive this because of how the surgery was done. But for me, I'm very hopeful that she is going to come out of this. But according to how the surgery was done, do you think she still have a chance?
Okay, according to how the surgery was done, first of all, we checked for infections because these guys definitely used non-sterile methods of removing the kidney. The objects they used were not sterilized. We thank God there was no infection, by the way. So it's just excessive loss of blood. That's hemorrhage. The hemorrhage was very high. She lost a lot of blood because of the excessive bleeding. So that's why on call, you remember I appealed to you that she needs guys, urgent guys who could come and donate blood, the O positive one. And I'm very happy how you guys responded to it, because very many people came here to offer to donate blood, and I'm very happy. Thank you for that.
I'm also very happy, by the way, to even the people who saw us and donated their blood. We are so happy. Actually, I'm so happy even to this hospital that an emergency blood donation was started. I know it's not just a small process, because the blood, then I had the other specialist saying it had to go through another testing to determine the group,
whether it's good.
It's good. It has some intoxications.
Yeah, sure.
I understand the tedious job you had to do to just make sure you save Grace, and I'm so happy that finally she is out of danger. But Daktari,
Yes.
I want first of all to understand this. Is it luck that we found her alive?
Yeah, it's
Because in any other circumstances, if this was to happen to anybody else, Grace would be dead before we could have found her.
You guys did the best thing, and I'm always happy how you guys take action. You remember the case of Brayo, how you took action, brought Brayo to this facility for medication. Now it's Grace, and I'm very happy how you guys respond, how you guys take it to your own hearts and hands, without knowing who the patient is, to bring her to hospital. May God always bless you.
Thank you.
It was a good thing.
Yeah.
It was a good thing.
How did she survive?
Oh, okay. The chances of her surviving, if you had not brought her here, were very minimal. But right now, because she's here, we have high chances of her being well. If she could have stayed out there for some time. I'm sorry. We could have lost Grace.
Because I remember in case of Brayo, I'm referring to Brayo so much because that was one of a cases that I had to witness one-on-one. The much that you said is that there were so many organs that were failing.
Sure.
What about the case of Grace?
The case of Grace, okay, the impact of the damage to the surrounding organs, that's the liver, the spleen, and the intestines, there was no much damage. That's what really helped her. The spleen was good, the intestines were good, and the liver was good. So we had high chances of getting her well.
Okay.
Yeah.
I know in the medicine field, there are so many subcategories. There are surgeons, there are gynecologists, there are just the normal doctor for the family. You know, there are how psychiatrists. Yeah. I don't know if you are I'm not sure if you are a professional surgeon, but I want to ask this question. Now that they got away with one kidney, can there be a chance that if we find it, she can be given back?
Okay, there are chances that she can be given back, but what I can tell you is that normally kidney transplants are done when both kidneys have failed to work. So she can live with one kidney. That's normal. People live with one kidney, but under manageable conditions.
Okay.
You see, one kidney, it has a range of effects to someone, starting from the kidney functions, that the hypertension, blood pressure, there is proteinuria, there is kidney stones. So living with one kidney is good, but it needs to be managed, and managing it is eating a good diet, and also there needs to be frequent blood test for serum in the blood,
Okay.
and in the so that like we can monitor the kidney functioning.
Okay.
She can work with one, but
So she can survive with one.
She can survive with one, but under manageable conditions.
Manageable condition, do you want, in simple terms, to mean she will have to live on medication for the rest of her life?
Not really medication, but managing her lifestyle.
Okay.
Yeah.
How?
Okay, you know the main work of the kidney is to clean
Blood.
you
Yeah.
see. So she needs like to, there are some kinds of lifestyle she cannot, there are things she cannot do when she has one kidney,
Yeah.
and like when someone has two kidneys.
Okay.
You see.
Yeah.
Yeah.
Oh.
That's it.
Going back to that similar case, there was a term that I am finding to best suit this scenario. Is this kidney harvesting, or is this kidney transplant?
Okay, how can I answer this? Okay, to me, when Grace was brought here, I was not here.
Yeah.
I was out, but the checks I've done on her body, these guys are okay. They did it not in a professional way, but they knew what they were doing. So this is the kidney harvest, because it's normal. People harvest for kidneys. It could be a kidney transplant. These people could have gone to a specialized person, a hospital, so that they could do and you know, a kidney transplant, I must come ask for your consent.
Okay.
Sign these papers. Are you free to give?
That's the question I was
out
coming to ask you. What's the process of doing a kidney transplant?
Okay, a kidney transplant, there are two types of kidney transplants. The donor can be one of the family, a healthy person. The donor can also be a deceased person, not a person who has died for weeks.
No.
A person who has died 2 days, we can use the kidney of that person to donate. But normally, the process, if it's you who wants to give a person the kidney, we must ask for your consent first. You must sign down that, yes, I'm this and this, and I'm willing to give out my kidney.
To donate one.
To donate one.
I'm asking this because where are kidneys sold? Because for the rest of my life, the few years I've lived, I've never heard anywhere kidneys are being sold. It's only that there are speculations in social media until I found this one. Only speculations in social media. Oh, you can sell your kidney, you can sell your kidney. But in a practical world, in most cases, the people that I know who have done kidney transplant, they usually get a donor. They are donated for free. Can a hospital sell a kidney?
Not really, unless otherwise. You see, unless there are cartels inside that facility, but profession-wise, as an hospital, you can't just sell someone's kidney. And I hear these stories dealing with the West African countries, or kidneys are sold somewhere, but I've never. This is my first case. I'm dealing with a patient who is said to have harvested the kidney and been sold.
Talking of West African countries, the kidney is purported that it was supposed to be, or it was supposed to be sold to a guy called Jaden in Peru. All right. How could they have managed to store this kidney they harvested and transport it to Peru? Was there any chance that the kidney could have arrived to Peru in good condition?
Yeah, the kidney could have arrived at Peru in good conditions. Was that through air transport? These guys, I've told you, these are cartels. These are guys who know what they're doing. These are guys who know where ready market is for the liver, the kidney. So these are processes that could be done very fast.
But I do believe we have good system in our ports, in our airports,
and in our ports. If it's via ship, we have good system. So I believe it's just some few elements, you see, because these cases are not normally everywhere. These are cases that are minimal. So what I believe, it's just some few elements. Yeah, and I believe let the course of law be done.
I'm not sure if I'm asking this question to the right person, but I need to ask it. In case they have managed to transplant Grace's kidney to somebody else, is there any legal suit we can do to just give her justice?
If the perpetrators are found, you guys can follow the right procedures to find good legal solutions to Grace. Let's see if we find the perpetrators.
So there
there are very low chances of you guys finding the people who did that. Let's see if you follow up and find. That's when you will find. That's when you may want to get the legal action done.
Yeah.
But if you guys don't find the perpetrators, then it's very hard.
Yeah. Okay, for me, I don't have much to say. Maybe in the question that do you have any question?
I am no.
You don't have any question, because this is the first scenario I'm witnessing. Somebody selling body part to someone, you know. The similar case we had like this ni ile ya Anthony. You remember the guy mwenye watu walikuwa wanasema anafanana na nani? Wanafanana na director.
Yeah.
That is the only scenario, and that Anthony gave the kidney willingly. Right? But he nao ni ngumu kidogo, si ndio? Definitely bills pale kwa nini naona zina nini? Pale kwa ICU naona
zinagonga juu there are a lot of things used in the ICU.
I think we come on to that next episode. Okay. Because I also need we get a report also from the ICU, maybe she's responding and tukuje na yote, si ni kweli?
Okay. Yeah, so we need Baba to be here.
Yeah. Baba Grace, yeah. Also to meet the father.
Okay.
The father to Grace.
Because everything atashika sisi patu ukimwambia hata things aliyashika jina na kama mtu wake.
Okay, no issue. I'll be so glad to meet the dad.
Yeah. So guys, ladies and gentlemen, let's meet in a bit. ICU, I didn't know bills huwa zinavuka mipaka. One day I remember, was it yesterday?
Yeah.
More than 260,000 one day. I didn't know. So this one is kungapi count. I didn't know, lakini ladies and gentlemen, staki niongee mingi. Maybe to be sincere, everyone knew sasa. Okay, let's meet in a bit. This is Pastor Show. I'm your host, Amstano, and of course, you're watching the best show. This is Pastor Show. Remember to subscribe. Hizo bills ni jana nililetewa nikashtuka.